Hello everyone, this is Dr. Arun here, consultant joint replacements and sports injury surgeon working at Reno Hospitals, Kompally. So today we will talk about the basics of knee and knee joint, and then we will come to the knee arthritis part. So when we talk about knee joint, the knee joint is formed by your two bones. This is your thigh bone and this is your shin bone. This is your leg bone and this is your thigh bone. The ends of these thigh bone and your leg bone forms the knee joint. Okay, for a basic example, simple example, like how this room is supported by the four pillars. In the same way, your knee joint is supported and it is kept stable with the help of four pillars. Two are on the sides and two are in between. These two side structures are called as a MCL and LCL, and the बीच वाला जो है इसको हम ACL and PCL बोलते हैं. All these four ligaments keep your knee stable in the sidewise as well as front and back. So what happens is that when these four ligaments are like completely solid and they are in equal in length, they keep your knee completely stable and it will protect your knee joint. This is your knee joint. The smooth covering what you are seeing on the ends of this bone as well as on this bone is a knee covering, and the blue structure what you can see is the meniscus. In a simple way we can call that as a cushion. And apart from this, your joint will be having an oil which, inside the knee joint, that is called as a hyaluronic acid, that keeps your knee completely, like it acts as a lubricant. So these four pillars along with that the oil, these protects your knee joint as well as the meniscus. So now we'll talk about arthritis, osteoarthritis. Osteoarthritis, usually it is a age related condition which is usually seen after the age of like around 15 females and after the age of like around 16 males. When we talk about the arthritis, the most common causes for the arthritis, first is most important is the age. Apart from that, it happens mainly in patients who are overweight and in patients who are more body weight is more, as well as they are diabetic, they are thyroid patients, as well as the patients who does more work while sitting down on the floor, like bending of the knee more than 90 degrees, like overuse of the knees. These are the conditions where, and also the level of water level of the fluoride levels in the water will also results in the increased damage of your knee, and this will lead to the arthritis. So when we talk about osteoarthritis, it mainly affects the inner side of your knee joint, not the outer side of your knee joint. Most of the cases it affects the inner side of the knee joint. Now you can see this blue color structure what we are talking about. This is the cushion, like it is a meniscus. So this is the inner side of the medial meniscus बोलते हैं इसको, and this is the lateral meniscus. So in osteoarthritis, the medial meniscus is the one which starts getting eroded. As like basically you can say that it is of 1 centimeter of thickness. Eventually when the arthritis will start progressing, the thickness of the inner side of the cushion will start getting eroded and it will go on decreasing. When this happens, the bones what you are seeing will start coming close to each other and they will start rubbing with each other. So when this happens, the smoothness what you are able to see here, this will start getting cracks, and that crack in your cartilage is called as arthritis. Like previously I said, there are two pillars on the sides and two pillars in the center. These two pillars, once the arthritis starts damaging the inner side, the pillar on this side shortens and the pillar on this side lengthens. In this way, your knee will start bending in this way. That's why you have seen many patients walking, they are walking with the waddling gait. So that happens mainly in the osteoarthritis, which affects the inner side of your knee joint. So when we talk about this osteoarthritis, it mainly affects the female age group after the age of 50 and males after the age group of around 60. So when it starts, it is divided into two parts, like it has got a stages. When we call it a early stage of arthritis, one is the advanced stage of arthritis. Early stage is like stage 1 and stage 2, and advanced stage is like stage 3 and stage 4. What happens is that in stage 1 and stage 2, the cushion what we were talking, it will start getting eroded, but completely erode nahi hoga. It will start getting damaged, but जो normal 1 centimeter का thickness रहेगा, it goes down to half of that thing. So that is the early stage of arthritis, where patients will start having pain whenever they are walking for a long period, and especially when the patients will start getting pain whenever they are taking stairs, and the patient will start getting pain whenever they are sitting down, and it becomes very difficult for them to get up from a sitting position. So these are the few basic symptoms which the osteoarthritis patients will face, and eventually they will start feeling they will start getting a cracking sound in their knees, which we call as a crepitus. So these are the signs of early arthritis, but deformity nahi hoga, but still they will be having these kind of a symptoms. So then comes the stage 3 and stage 4, जहाँ पे आपका जो meniscus है, this will start getting eroded completely and these bones will start touching with each other. What happens in this way, this condition is that patients will start experiencing severe pain in their knee. They can't even walk for half a kilometer, and it becomes very difficult to take stairs, and it becomes very difficult. Not only difficult, they can't even sit down, and they can. One more important thing is that we can the stage 3 and stage 4 patients. By just looking at them, the change in their walking pattern will only say that they are in the advanced stage of arthritis. So, as arthritis is a damage of the cartilage and damage of the meniscus, these structures, cartilage and the meniscus, don't have blood supply, or the blood supply is very minimal. That is the reason the arthritis becomes very difficult to control, and eventually the patient will start going from stage 1 to stage 4 as the damage progresses as well as the age progresses. So to diagnose the arthritis, it just requires hardly 5 minutes of clinical examination, and just no hi-fi investigations is required. Just a basic simple x-ray of your knee, a standing x-ray and a lateral x-ray of your knee will confirm that whether you are in the arthritis or you are not in the stage of arthritis, or whether you are in the early stage or in the advanced stage. Once it is confirmed that you are in the early stage of arthritis, that is in the stage 1 and stage 2, you have to understand that it is not just one particular treatment which will protect you from helps in controlling the arthritis. It is a combination of treatment. The main heading, you can say it as a offloading of your knee joint is your treatment, and that offloading can be done in different ways. So in stage 1, stage 2, the main treatment is offloading of your knee joint. The first thing offloading is that start doing physiotherapy. Physiotherapy means building all the muscles and structures around your knee joint, make them strong enough so that the pressure on your knee joint will reduce. And hot water fomentation, that will also help in increasing the muscle blood circulation and helps in keeping your muscles healthy. So at least 2 times of physiotherapy, a good knee physiotherapy and hot water bag. And the best exercise is a swimming and cycling. If possible, go and do a indoors. At least you can start doing the indoor cycling as well as start swimming. If you don't know swimming, you can just go into the swimming pool and start walking in the swimming pool. That will help in building your knee strong. So the second offloading is that you have to reduce the pressure on your knee, and that important first thing is you have to start taking precautions. That is, first stop, avoid taking stairs, because when you take stairs, the pressure on your knees goes into 3 times, into 4 times. So wherever possible, don't use stairs. Second precaution is don't sit down. I mean, don't bend your knees more than 90 degree for whatever reasons, for your washroom activities, for doing, if you have a habit of sitting down and having food, convert it into such a position where you can sit on a chair and your knee bending will not be more than 90 degree. जो भी काम आप नीचे बैठ के करेंगे, stop all those and take alternative of sitting on the chair. And third most important thing to protect your knees from progressing the arthritis is reduce your body weight. Whatever body weight you are having, check according to your height and आपका एज के हिसाब से जितना बॉडी वेट रहना चाहिए, आपका BMI रहना चाहिए, योर बॉडी वेट हैज़ टू बी अकॉर्डिंग टू दैट. एंड इफ इट इज़ ओवर वेट, देन स्टार्ट रिड्यूसिंग योर बॉडी वेट. दैट विल रिड्यूस द प्रेशर ऑन योर नी जॉइंट्स. सो द थर्ड काइंड ऑफ offloading is your joint naturally has a oil called as a hyaluronic acid oil. So arthritis may we have to give these hyaluronic acid oil injections that will protect your knees for 6 months to 1 year. That has to be repeated every 6 months to 1 year. Apart from that, you have a PRP injection, so where we take your own blood and derive the we'll extract the platelets from that and inject into your knee. So hyaluronic acid and PRP injections, but only in stage 1 and stage 2. So the fourth thing is the medications. Medication parts, stop avoiding painkillers. I mean, stop taking painkillers, because the arthritis is an age related thing. It is not just like 1 day 2 day thing. That will be there for your lifetime. and you have to keep it under check. So if you are dependent on painkillers, then you will have a lot of side effects of painkillers that will affect your gastritis, gastric problems, your renal problems, all things will increase. So stop painkillers first thing and start taking supplements for your bones, for your muscles, for your ligaments, for your tendons, for your nerves. These supplements will help in building the structures around your knee joint stronger and help in offloading of your knee joint. So yeah, stage 1 and stage 2, the offload is your treatment. The first is the physiotherapy and the hot water bag fomentation. Second thing is reducing your body weight and taking all the precautions. And third thing is the joint oil injections, that is hyaluronic acid or the PRP injections. And the fourth thing is the medications. So now we'll come to advanced stage of knee arthritis. Advanced stage of knee arthritis is a condition where your meniscus, the cushion has got completely worn out and the bones are touching with each other. With a simple x-ray, you can see on the x-ray picture that the bones are touching with each other and आपका cushion उधर completely घिस चुका है. So under such conditions, it becomes very difficult to have a conservative management. Why? Because patient will be in a severe pain. Under such conditions, it will be very difficult to do the physiotherapy. Under such conditions, it is very difficult to take all the precautions, and it is very difficult to reduce the body weight, because to reduce the body weight, you have to take at least 3 to 4 kilometers of walking, do cycling and swimming. It becomes very difficult with such painful knees to do all these things, and also the medications will also not help you much here. And believe me, stage 1, stage 2 chhod ke, so the advanced stage of knee arthritis, conservative management will eventually fail, or that will not help you much. So don't go for any kind of oil injections or the PRP injections. That will not help you much. It will add a financial burden to you. So the best way to treat the advanced stage of knee arthritis is to opt for knee replacement surgeries, where the patient undergoes surgery. Jahan pe knee replacement doesn't mean that we'll change the entire knee. It is just the covering of this bone, the cushioning, as well as the covering of this bone will be changed by a metallic implant, where the patient will be able to start walking the next day of the surgery itself. So yeah, advanced stage of knee arthritis, don't go for a conservative management. Knee replacement is a solution for your advanced stage of knee arthritis.